Can you walk me through your resume? So, good day, and thank you for giving me this opportunity to be your interviewee. And I would like to introduce myself. I am Jasmine Kaye Cancino, and I earned my Doctor of Veterinary Medicine degree from the University of the Philippines, Los Baños, where I received strong academic and clinical training in small animal, large animal, and poultry medicine. During my clinical rotations at the UPLB Veterinary Teaching Hospital, I was actively involved in patient intake, history taking, physical examinations, laboratory diagnostics such as fecalysis, urinalysis, CBC preparation, and skin scraping, as well as surgical assistance in procedures like ovariohysterectomy, castration, and minor soft tissue surgery. I also participated in community outreach programs conducting anti-rabies vaccination drives, deworming campaigns, and client education seminars. After I graduated, I immediately took the veterinary licensure examination and became a licensed veterinarian. To further enhance my skills, I also completed CPD accredited trainings in small animal clinical pathology, rabies prevention and control aligned with the national guidelines, good laboratory practices, basic ultrasonography in small animals, and antimicrobial stewardship in veterinary practice, along with continuing education webinars under the Philippine Veterinary Medical Association. What relevant experience do you bring to this position? Thank you for your question, and I think that my relevant experience that I will bring for this position is through my clinical rotations and trainings. I developed confidence in performing comprehensive physical examinations, formulating differential diagnosis, interpreting laboratory results, administering vaccines, managing IV catheter placement, and fluid therapy. Also assisting in surgery and providing post-operative care and discharge instructions. I also gained exposure to herd health discussions and preventive programs during my large animal rotation. My GLP and antimicrobial stewardship training strengthened my understanding of infection control, biosafety, and responsible prescribing practices. In addition to technical skills, I bring strong communication abilities, ensuring that treatment plans and preventive care instructions are clearly explained to the clients. Tell me about the time you faced a challenge at work and how you handled it. I think it happened during my internship. I assisted in an emergency dystocia case that required immediate surgical intervention. The clinic was so busy and time was critical. I helped prepare the surgical area, ensured sterile instruments were ready, monitored anesthesia, and assisted in neonatal care. The challenge was maintaining efficiency while strictly following aseptic protocols. I stayed calm, prioritized tasks, and communicated clearly with the team. In another instance involving a suspected parvovirus case, I applied strict isolation and disinfection protocols based on my GLP training to prevent contamination. These experiences strengthened my ability to remain composed, systematic, and effective under pressure. What motivates you to perform well at work? I am motivated by the responsibility of advocating for animal welfare, as animals rely entirely on veterinarians for their health and safety. Seeing patients recover and knowing I contributed to improving their quality of life drives me to maintain high standards in my work. I am also motivated by continuous growth, actively attending seminars and CPD programs to stay updated with current practices. I take pride in accuracy, whether in drug dosage calculations, documentation, or client communication, and I consistently aim to practice ethically and responsibly. What would you do if you disagreed with your supervisor? I think if I disagreed with my supervisor, I would approach the situation respectfully and seek clarification to better understand the reasoning. If appropriate, I would share my perspective supported by clinical references or evidence-based guidelines. However, I value mentorship and recognize the importance of experience in clinical judgment. I would ultimately respect the final decision and use the discussion as a as an opportunity to learn and improve my own decision-making skills. What kind of work environment helps you do your best work? I thrive in a collaborative, organized, and growth-oriented environment where teamwork, open communication, and ethical standards are emphasized. I value clinics that encourage case discussions and continuing education as I am committed to lifelong learning. My goal is to continue developing my skills in internal medicine and diagnostic imaging while contributing meaningfully to patient care and maintaining compassionate client service. When can you start? I am available to start immediately, and I am also eager to apply my academic training, clinical experience, and professional certifications to contribute effectively to your team while continuing to grow as a veterinary professional.